Hello, I'm Dr. Bill Waggoner. Welcome to today's Tuesday Tip. For as long as I've been a pediatric dentist, which is going on 40 years, the issue of parents in the dental operatory has been a topic of spirited debate within the profession. In the 60s and 70s, it was commonplace for parents to be excluded from the operatory during treatment. I'd say it was probably during the 1980s when we started to see a few more parents being invited into the operatory. And today, I would guess that the vast number of pediatric dentists have the parents in the operatory for a majority of the child's dental visits. But the question that has long been debated is, does the presence of the parent cause a child to behave better or worse? Is a child more or less anxious or fearful? Over the last several decades, there have been a number of studies that have looked at the effect of the parent's presence on the child's behavior during dental treatment. Some of the studies have found that the child's behavior improved with the parents present. Some have found that the behavior worsened with the parents present. And some have found no effect at all on the child's behavior. An article published in 2021 in the International Journal of Pediatric Dentistry reported on a systematic review of the literature about this very topic. Does the presence of parents in the dental operatory influence children's behavior, anxiety, or fear during their dental treatment? The short answer is no. In this review, the presence of a parent did not seem to affect behavior or anxiety. But how did they arrive at this conclusion? With systematic reviews, a wide literature search on the topic is carried out, and then articles meeting certain criteria are kept for review and others are discarded. In this particular systematic review, they started with 2,846 possible papers, but they ended up with only 16 to be included in a qualitative analysis and then only 5 papers in a meta-analysis. For the purpose of this review, trying to find randomized, non-biased studies was a significant challenge. The authors also rated the studies as to the level of certainty of the evidence. Now, after all of the analysis of the literature, it was concluded that the parents present in the operatory does not influence a child's behavior or their anxiety or fear during dental treatment. They also concluded that there was a very low certainty of evidence associated with these studies. Now, much of this desired information is probably a moot point anyway. Regardless of how we as clinicians feel about the parents being in the operatory, the reality is many parents expect to be constantly present with their child during treatment. We all have our clinical experience where we know for a fact that certain children act out more with their parent present, while other children are more settled with mom or dad there. Our own clinical judgment and preferences can help us decide what may be best for each individual child, because it seems that according to the literature, whether the parent is present or not does not significantly affect the child's behavior or anxiety. Now, what it may do to a parent's behavior and anxiety is another issue altogether. Well, that's it for now. Thanks for watching. I'll see you next time.